Before you watch this episode of our cityCURRENT radio show, I want to invite you to join cityCURRENT's e-learning and online personal development platform called GrowthCurrent. I'm Jeremy Park, host of the cityCURRENT radio show and CEO of cityCURRENT. GrowthCurrent is your exclusive ticket to attend virtual events with global thought leaders, national guest speakers, and experts who can help you grow personally and professionally. It gives you access to success secrets, lessons learned, learning modules, and so much more. Being online, you can join us from anywhere in the world. Subscriptions are only $8 a month, or you can do bulk subscriptions for your team. Check out growthcurrent.com to learn more and to join us in our efforts to power the good. And now, on to the show. Welcome back to the cityCURRENT radio show. I'm your host, Jeremy Park. We're honored to be with our next guest, John Mickner. He's the CEO of Universal Health Advisors and the COO of the Tennessee Immigrant and Minority Business Group. How are you doing, John?
I'm doing great, Jeremy. I hope you are too.
Doing well. So let's start with some context. Give us some background on Universal Health Advisors. Let's start there.
Okay. Universal Health Advisors was founded on the principle or the mission of being transparent in healthcare. And of course, that's something that's been argued back and forth now for, it seems like forever. But what we mean by that is giving people the tools where they can actually shop for prescriptions. They can get prescription costs before they go into a drugstore or whatever to purchase that. They can get information about certain procedures. They can shop for procedures. That, so it's bringing complete transparency to the healthcare medium. And we also have kind of changed the pyramid, the medical pyramid, where we're saying, instead of running to the emergency room first, why not start with either just a primary care doctor or even better, telemedicine, something where you can get a first triage type of thing before you move up that scale and cause some really big expenses.
Like anything, knowledge is power, and especially when you talk about transparency and you're working with individuals and small and large corporations. Talk about that idea of transparency, but at all levels.
Okay, the primary focus is with small business, small to medium-sized business, and of course that reflects on their employees. Small and medium-sized businesses don't have the wherewithal, the financial wherewithal, and a lot of times the resources to get the Cadillac, so to speak, insurance programs, to be able to get all of the things that they need. But we've gotten it down to a point where even a small business, by small I mean like maybe under $30 million in revenue, they can actually set up a clinic, a virtual telemedicine clinic, right in their facility, so that, for example, someone can go there rather than having to run out to the doctor or run to the emergency room. And if it's just a matter of getting a prescription or just getting some information, they can do that right there while they're at work. So, and then again, we have an app, for example, that will allow you to talk to a doctor just for information. You can, again, shop around for the different services, and you can also have concierge service on there where you're able to favorite a doctor and then be able to speak to that doctor on a regular basis. So, and these are the type of things that the cost is the same as it would be for a large corporation per employee. And that's the real key. So it's available to everybody.
Yeah, and the power of leveraging technology to make it efficient and effective. And to your point, where workers can basically access it immediately, either in the office or at home through technology, but then make it cost effective. You're really, really helping these companies access and leverage technology in a powerful way to help their employees.
Exactly. And the only, I don't know what term to use, but the only thing that's holding all this back has been some of the legislation, which has opened up recently, unfortunately, due to COVID-19, where a lot of the restrictions for telemedicine, telehealth have been reduced or even eliminated. And now we actually can have it paid for through Medicare and so forth. So before those that didn't happen before. Before it was strictly cash pay. And now it's being accepted by insurance companies and so forth. So it's really, really opened up the whole industry.
What do you think is next, or what do you have your eye on next? I mean, when you talk about the power of technology, it creates endless opportunities. So what are you looking at in the future in terms of a next step?
That for us, the next step is going to be getting telepsychiatry into more locations. The nursing home industry in particular, nursing homes, assisted living facilities, even hospitals are in a having a real problem with bringing in psychiatrists. They either don't have enough of them, or they come in once a week for a short period of time. And in most cases, when a psychiatrist is needed, it's an emergency. It's because somebody is really acting out, somebody's having a bad time, somebody needs immediate intervention. And telepsychiatry or telehealth using with psychiatrists on board will allow for that. And this is fully paid for by Medicare or Medicaid or even private insurance. And this is something that we see as the future, because mental health is a very, very big issue in this country, especially for the underserved population, rural areas, and minorities. A big, big issue.
Yeah, and once again, back to the power of leveraging technology. If you can put them literally face to face, so to speak, leveraging technology to give them instant access, especially when they're dealing with a very difficult circumstance right in that moment, there's a powerful opportunity to be able to offer healing and support that can put them on a positive path versus a destructive path, which is powerful.
Exactly, and it also it helps out the staff, because again, they're dealing with their own things, and then all of a sudden there's an outburst, or there's somebody that just needs that needs that session with a psychiatrist. So it calms the staff down, calms the patient down. Again, it's immediate, instant access, and this can. Oh, by the way, this is all set up in the facility for free, no cost. And then we are paid through the healthcare system. We're reimbursed that way. So, and it does not detract at all from the facility staff. They still do their thing. If they still have a psychiatrist that's coming in occasionally, once a week, whatever it might be, that is not a problem. This again is for 3 o'clock in the morning type situations, Sunday afternoon, Christmas Day, whatever. They would be able to access this and be able to take care of the situation.
Let's switch over and talk about your role as COO of the Tennessee Immigrant and Minority Business Group. Describe the Tennessee Immigrant and Minority Business Group, and then we'll talk about some of the upcoming opportunities.
Okay. I first got involved with them about 5 years ago. Dr. Ming Wang and Dr. Galen Hull founded the organization. And the mission of the Tennessee Immigrant and Minority Business Group, or TIMBG, is to bring primarily business owners, influencers from the different cultures, from very many cultures, together to find common ground, common interests. Again, this is something that's very big, especially right now. With the differences, we're promoting the commonalities. Even though you may be from a different culture, it's the same there as it is here. What's very difficult for immigrants and minorities in particular here, especially immigrants coming in, a lot of them are business owners, or they have professional degrees for where they came from. When they come here, they don't know who to contact. They don't know who they can trust. They don't know where to get the resources and get the information and help that they need. And TIMBG is focusing more and more and more on doing that. We have quarterly forums that are based on particular topics. We've had some on healthcare, some on social media marketing, some on how to get a business started, some on innovation in your business. How do you innovate now? One that's coming up in November 12th, is going to be on legal issues facing immigrant and minority businesses. And we have a panel of expert attorneys. Two of them, in fact, are immigration attorneys that are going to be able to help with certain situations. For example, we've had a number of small immigrant businesses that got into some legal trouble because they didn't know they had to do certain things. They didn't know they had to file certain paperwork. They didn't have to do that in the country they came from. So all of a sudden it's, where did this come from? I didn't realize I had to do that. So, we have, so that's when they need to be able to reach out to someone and say, can you help? Can you point me in the right direction? So what we try to do mainly at TIMBG is connect people with resources so that they can get the help that they need and be able to, and the other part of that too, Jeremy, is the entrenched people, the people that have been here for a long time, the business owners that have been here for a long time are going after the same prospects for business. They're chasing the same dollars. And I mean, it's not all about the dollars, but they're chasing those same dollars. And if they're not working with the immigrant and minority businesses, they're missing a huge, huge business potential. And that's what we try to promote.
The event coming up on November 12th is going to be via Zoom. And so talk about where listeners can access that information. Where can they go to just be in the know about all these upcoming events and opportunities?
Okay, they can go to the website, timbg.org. They can also email me. It would be initial J, Mickner @gmail.com. And we'll get them on a mailing list so that they're made aware of all the upcoming forums. Those would be the two best sources right there. And then we usually have between 80 to 100 people at these events. Now that we're going on Zoom, it's been cut back a little bit, but I think we had 48 people on the last call. And again, people from every background and culture you can think of. It was like a Zoom meeting for the UN. It was really, really great. So we invite anybody, but again, particularly it's business owners, influencers, teachers, pastors, anybody that can that associates with the type of people we're working with would be great.
What's something that you've learned when you look at being a part of the Tennessee Immigrant and Minority Business Group? What's something that you've learned there that you've applied and taken over to Universal Health Advisors? So what's a lesson you've learned or something you've taken in terms of, learning it here and then applying it over here?
I think that again, the biggest thing is that, I come from a very small coal mining town in Pennsylvania. There was not much diversity there. There was, as far as different people from different parts of Eastern Europe, but that was about it. What I've learned from TIMBG is, again, that there are people with needs, there are people with desires, and people that want to accomplish the same things from many, many different cultures. So what we've been able to do through Universal Health Advisors and technology in particular is be able to say, well, if the Latino community, for example, needs help with finding a doctor, needs help with getting a telemedicine visit, they can do so, and they can talk to someone in their language. That we don't cover, that doesn't cover all of the languages, but it does cover a few, particularly Hispanics. And so they can talk to a doctor in their own language and feel comfortable that way. So it's a combination of the technology, getting to get the culture and science coming together. And it's evolving where we're going to be able to have more and more cultures involved on the medical side of it. But again, I think what I've learned more than anything is that it doesn't matter what culture you're from, what country you're from, you've got the same wants, the same desires, the same needs. And technology really helps a lot with that. It really does.
Yeah, I think going back to your point too of looking for the commonalities, looking for what makes us alike and not different to bring us together. And then to your point too about really being intentional about helping to find and identify the gaps and then help and be the solution and the support network to be able to genuinely pour in and help them. And obviously doing that on both ends of the spectrum with the Tennessee Immigrant and Minority Business Group, and then also obviously with Universal Health Advisors. Wrap up and talk about website and social media and everything for Universal Health Advisors and where people can go to access that information. You mentioned your email, but talk about just website and other methods to get to you.
Okay, the website would be universalhealthadvisors.com. And we're also on Facebook. There's a Facebook page. You can just go and look for us there. Same thing with TIMBG. So the website, Facebook, and you'll be seeing a lot of information coming out more and more on the telepsychiatry that I mentioned, and also working with a lot of civic and faith-based initiatives to be able to bring healthcare into the faith-based community. And when I say faith-based, I mean all. This is where healthcare needs to find or to reorganize, to have a rebirth. And we're working, I can't go into that here, but we're working with a number of people in that area to bring healthcare through the faith-based organizations.
Yeah, I think that's a really strong move. And obviously, when you look at their ability to connect with the congregation and create a community, the ability to put health in front of that community and make it top of mind is needed, but it's also a powerful way to really to lift the health of our community at large. So, John, thank you very much for you and your team. Thank you for all you do. Thank you for being a part of the show. Appreciate it.
And I appreciate being invited to do this too. It's very, very enjoyable. Thank you very much.